Sir, good morning, sir. I am Tapil Maria de Luna T, your student from Forensic 4, Section G. So, I am here to discuss my answers of the 15 questions that you have given to us. So, first question, what is polygraph instrument? A polygraph, popularly referred to as a lie detector test, is a device or procedure that measures the record several sociological indicators such as blood. Second question, what makes pneumograph component different from cardio component? Simply stated, the pneumograph component record on paper a graphic display of a respiratory pattern. A pneumograph channel is a low pressure, airtight chamber which consists of tubular rubber below assembly connected to the actuator assembly via rubber tubing. So, third question. Enumerate the accessories that are going to be attached in a subject's body. When the subject breathes, changes in the air pressure in the tubes are recorded on the polygraph. The galvanograph section record the amount of respiratory produced. It consists of electrical sensors called galvanometers that are attached to a subject's fingertips. Fourth question. Enumerate some of signs and symbols commonly used in polygraph examination. A polygraph, popularly referred to as a lie detector test, is a device or procedure that measures and records several sociological indicators such as blood pressure, pulse, respiration, and skin conductivity while a person is asked and answers a series of questions. Number 5. What is chart interpretation? To interpret a graph or chart, read the title, look at the key, read labels, then study the graph to understand what is shown. Read the title of a graph or chart. The title tells what information is being displayed. 6. What is the important features of an examination room? A movable monitor best allows information to be clearly viewed by patients, provide adequate space and seating for family members if they need to participate in the conversation. Surface that moves easily when you perform the physical exam. A whiteboard can help capture questions or next steps. 7. Discuss the four phases of polygraph examination. Pneumograph, an instrument for recording thoracic movement of volume change during respiration. So, the first phase of polygraph is pneumograph. Second is cardiosymographic simograph. It is a pressure and heart rate are measured by the cardiosymograph component of the polygraph, which consists of a blood pressure cuff that it wrapped around the subject's arm. During the questioning of cuff remains inflated. Third, galvanograph. When the subject breathes, changes the air pressure in the tubes are recorded on the polygraph. The galvanograph section records the amount of perspiration produced. It consists of electrical sensors called galvanometers that are attached to the subject's fingertips. So, fourth, chemograph. So, chemograph is an instrument for recording variation in pressure, in sound waves, or in blood within blood vessels, which the trace of a stylus on rotating cylinder. Number 8 question. What is the purpose of the pretest interview? The pretest interview conducted prior to actual polygraph examination. It is vital to the diagnostic examiner not only in obtaining an ambiguous record but also in the overall interpretation of the subject's truthfulness. Excuse me. Number 9. What makes pretest interview different from post-test interview? Typically, a pretest is given to student that is being on a course or determine their initial understanding of the measures stated in the learning activities objectives. And post-test is conducted just after completion of the course to determine what the student have learned. Number 10. What are the different types of questions? So, there are four different types of questions. Number 1, the general or yes or no questions. Second, special or what question. Third is choice questions. And fourth is disjunctive or tag questions. So, number 11. What is silent test all about? Based on the current research indicates that the silent answer test method of lie detection is more reliable than the able answer test method. The audible answers test procedure has inherent testing objectionable movement resulting from or indecent to required verbal responses. Number 12. What is pre-employment test? It consists of the use of tests and questionnaires to assess candidates in terms of wide range of aspects such as cognitive ability, critical thinking skills, personality, preferences, and motivation, among many others. Number 13. What are the specific objectives of polygraph examination? The primary purpose of the polygraph test is security screening is to identify individuals who present serious threats to national security. To put this in the language of diagnostic testing, the goal is to reduce a minimum the number of false negative cases, serious security risks who pass the diagnostic screen. So number 14. What is polygraph examination necessary? The primary purpose of the polygraph test in security screening is to identify individuals who present serious threats to national security. To put this in a language of diagnostic testing, the goal is to reduce a minimum the number of false negative causes, serious security risks who pass the diagnostic screen. So 15, the last but not the least question, who is a polygraph examiner? Polygraph examiner use polygraph equipment and techniques to determine whether individuals have answered question truthfully. So that would be all, sir. Thank you so much. God bless.